As a parent, every flutter and every change in your baby's tiny body can bring a wave of questions and sometimes worry. It is completely natural to feel a surge of concern when something seems different, especially when it involves their vital signs. You are constantly monitoring, learning, and instinctively protecting your little one, and recognizing subtle cues is a big part of that. A weak pulse in your baby can indeed be a significant sign of illness and should be taken very seriously. It often indicates that their body is struggling to maintain adequate blood circulation, which means vital organs might not be getting enough oxygen and nutrients. This is not something to observe and wait on. It requires immediate attention. The underlying reason for a weak pulse often comes down to issues with blood volume or heart function. For example, severe dehydration, where the baby has lost a lot of fluids, can reduce the amount of blood circulating, making the heart work harder with less to pump. This results in a weaker pulse that is sometimes also very fast. Conditions like septic shock, a severe infection spreading throughout the body, can also cause blood vessels to widen, leading to a drop in blood pressure and a weak pulse. Even some serious heart conditions, though less common, might present with a weak pulse, as the heart is unable to pump blood effectively. If you notice your baby has a weak pulse, the most important step is to seek emergency medical help right away. You can gently check their pulse at their upper arm, near the elbow, or in their groin area, but do not delay calling for assistance while doing so. While waiting for help, keep your baby calm and warm, and try to make sure their airway is clear. Look for other accompanying symptoms such as unusual drowsiness, pale or bluish skin, cold hands and feet, or very rapid breathing, as these can provide critical information to medical professionals. Understanding your baby's baseline is crucial here because what is normal for an infant can be very different from an older child or an adult. A baby's normal pulse rate is significantly higher, often between 100 to 160 beats per minute when resting, and even higher when active. A pulse that feels weak, or is unusually slow or fast, particularly in combination with other worrying signs, should immediately raise a red flag. Medical professionals will assess for conditions like hypovolemic shock, meaning low blood volume, or cardiogenic shock, which relates to the heart's pumping ability, both of which requiring urgent treatment. Ultimately, your parental instincts are a powerful tool. If your baby's pulse feels weak, or if they just do not seem right, it is always best to act quickly and err on the side of caution. Prompt medical evaluation is essential to determine the cause and ensure your baby receives any necessary care without delay. Recognizing this critical sign means you are actively protecting your little one's health and well-being.